Hey guys, can you hear me? I have the notes for you, so I'm going to actually post the notes right now. You can download the notes. There we go. Let's see here. You can hear me okay? All right, let's see. To let everyone get on, so we can hear each other. Let's see here. I posted, so you can download the notes, print it out as we go through this, and it should be in the chat. Let me know if you see this link, because I was wondering if you could see it or not. Did you guys get the link? Okay, good. It downloaded. Perfect. Let's see. I'm just going to position this a little bit better. Okay. All right, cool. Let's see here. Okay. Welcome. So we're going to get started. Right. We are going to talk about, this is part 2, and we're going to be talking about estrogen, and we're going to talk about the ovary, we're going to talk about testosterone, we're going to talk about low testosterone, we'll talk about the female hormones and as it relates to the thyroid. And I just wanted to make sure that you guys, this link is correct. So I'm just going to test it before I move on, just because. Let me just see if it works here. Okay, that should work. Yeah, someone said the webinar says it's part 1, but this is part 2. Yeah. All right, cool. All right, so good, good, good. You guys are already asking questions. Totally fine. So let me just what I'll do is I'll cover some data, and then we'll answer some questions. How about that? Awesome. Okay, so last week we covered some information about insulin, the adrenals. So we're going to talk about the gonads. What are the gonads? It's the testicle and the ovary as it relates to their main hormones. Now, there's a lot to know about estrogen. We're going to cover the stuff that only problem that shows up that relates to your body. And I'm just going to make sure I have my references right here. Let me just check everything. Voila, I have them right here. Okay, cool. So I'm just going to open these slides. Let's just close some of the stuff down here. Okay. Perfect. All right. Got it. Okay, so I can make this a little bit bigger, but last time the slides got stuck. So tonight I'm going to just check on to make sure these slides are working, okay? So we're going to talk about the gonads. What are the gonads? The gonads are male and female reproductive organs. Let's start with the ovary. The ovary makes estrogen The ovaries create hormones to create female characteristics. It gives the woman their curve. Certain cultures have different, more accentuated curves because they have more of a certain hormone, estrogen. Controls the menstrual cycle, controls making the egg fertile in the uterus. And then you have the testicle. The testicle makes sperm, responsible for your libido. Bone and muscle influences, vitality. And it also works closely with another gland called the prostate. Now, I'm just curious, as I go through this, I want to make sure that there's no words that I give you that you don't fully get. So does anyone know what the prostate does? Okay. Can you, I'll have to wait just a second here. What does the prostate do? Does anyone know? Give it a second here. Okay. I don't know. I don't know. Someone says it produces testosterone, gives us enzymes. No, no, no. That's where the semen is. Okay. So apparently you don't know. That's totally fine. So enlarges when you get old? Exactly. So the prostate does really two things. It doesn't make sperm. It, okay, when a male ejaculates, the sperm goes out and it pushes the sperm. It also provides a fluid that goes along with the sperm to help the sperm survive. But you also have other glands around that that also assist. Okay, so that's what the prostate does. Oh, you know. Okay, let me go back to my slides. All right, so I'll try to enlarge this so we can see, and you'll just have to, I'm going to see if this actually advances. Let me see if it worked. Let me see. Yes, it did work. Okay, good. So I can do this. Awesome. So we're going to talk about estrogen dominance. This is the most common problem with women, but not even before menopause, even after menopause. And I'll explain why. Because as you age, you're supposed to lose your estrogen, right? But there's other parts of your body and tissues, like your fat cells, that make estrogen. So if you have a lot of fat after menopause, your body can make a lot of extra estrogen. Yeah, your adrenals make estrogen. The adrenals are the backup organ to the ovaries. So during menopause, you can have estrogen dominance for that reason, and also because another hormone called progesterone drops down too, even more than estrogen. So it gives a relative increase of estrogen because estrogen and progesterone work together. So during menopause, if progesterone really drops down to the bottom, you're left with a relative high ratio of estrogen to progesterone. You're still estrogen dominant. So you need both of those hormones to work together. But if you're estrogen dominant, you're going to get what's called endometriosis. Endometriosis is a condition where you get scar tissue that kind of develops because of extra estrogen around the inside your abdomen, around the uterus, inside the uterus, all over the place. The endometrium is kind of like the lining of the uterus. Okay, so it's the whole lining of the uterus. That's what it is. Irregular periods, cellulite, especially in the outer hips, the lower pooch of your belly, and your thighs and your butt. Okay, infertility. That's why they give you birth control pills, more estrogen, to make you not fertile. PMS, mood changes, depression, all these different things. Fibroids, ovarian cysts, breast lumps, thyroid nodules. So those are all of the symptoms of estrogen dominance. Okay, there's more. The next thing you need to know is that during a menstrual cycle, you have these hormonal shifts. At day 14, you have the spike of estrogen that spikes up and it spikes down. So in other words, day 14 is a very different time period for the cycle in that you're the most fertile. That's when you're ovulating. That's when the egg is being released down these little tubes, fallopian tubes, down to the uterus and become fertilized. So you have this spike of estrogen. So estrogen is the hormone that spikes at day 14. Okay? It just comes up and it goes down. You also have another hormone called luteinizing hormone. That's for the brain. And follicle stimulating hormone. That's in the brain too from the pituitary. But don't worry about those at this point. The thing you need to know is estrogen increases at day 14. And progesterone increases about a week before your period. So if you have a problem like 1 week before your period, you know your cycle is all messed up, or you have moodiness or craving or whatever, we know it's progesterone. If it's during ovulation, we know it's estrogen. Okay? Symptoms of high and low estrogen. Too high, breast tenderness, bloating, emotions up and down, pounding headaches, weight gain, yeast infections, depression, excessive growth of the fibroid, fibrocystic breast, joints pain, water retention, irritability, blood sugar issues. Now, if it's too low, you're going to have hot flashes, night sweats, insomnia, mental fogginess, decreased sexual drive and lubrication, so vaginal dryness, depression, fatigue, frequent urination, migraine headaches, memory and concentration problems, dry skin, osteoporosis. Other than that, you're perfectly fine. Okay, just want to make sure that you're okay. So I'm just going to kind of answer a question as we go through. Someone says, and they said, I thought you said if you have hot flashes during menopause or postmenopausal, that meant that you have too little estrogen, but you also have belly fat. That would mean that the estrogen dominates, so you have too little and too much. Okay, very, very, very good question. Here's what happens. It's very, very similar to estrogen resistance. Insulin resistance shows high levels of insulin on one part of your body and low other. Same with cortisol. You can have symptoms of high cortisol and low cortisol because you have cortisol resistance. So when the estrogen becomes high, downgrade and become resistant, and so you have symptoms of low and high at the same time. That's really what's happening. So going in the vaginal area, so you become dry. So it's not going into, it's not, the adrenals are not backing them up effectively, so you get hot flashes, night sweats. So it's not clear cut, and that's why when you take estrogen and you have hot flashes, for example, you can get rid of hot flashes just like that by taking HRT, hormone replacement therapy. But then it creates all these other problems of estrogen dominance. So it fixes one thing but gives you another problem like cancer. So that's what happens. Now, let me just see if there's any other quick questions here. Okay. Slide didn't advance. Darn it. Okay, so we're dealing with that again. Okay, so what I'm going to do is I'm just going to go back and forth so we can make sure slides, okay? So I won't go like 5 slides into it. So let me just go to the next slide right now. Okay. Estrogen therapy. Okay, so here's what happens. Women, some women take estrogen. A lot of women are stopping to take taking the hormone replacement therapy like they did like 10 years ago or 20 years ago because it has some side effects. Okay, stroke. My mother, she worked as a nurse, and I was able to acquire some of the records in the nursing home of people who had been on estrogen therapy or hormone replacement therapy. And I noticed one common denominator. They all had strokes, which is interesting. So too much estrogen can lead to blood clots, okay? Cancer. Women who took estrogen are 4 to 7 times more likely to develop cancer. Now, why does this relate to the endocrine system? Because with women, there's so many receptors for estrogen, like especially in the breast, in the uterus, in the ovaries, and that's what's happening if the estrogen is going too high. But from my viewpoint, this is just my opinion, I don't think this is coming from necessarily your estrogen. It's coming from the environmental estrogen, okay? Now, there's another question that someone said, well, what about hormone replacement therapy, like bioidentical hormones? Okay, is that better? That's better, but my thought is that if you're going to go on HRT or bioidentical hormones, what I would recommend is that you first try to fix the real problem, okay? It's not normal for you to have symptoms even past menopause if we are working properly. And don't buy into that, oh yeah, everyone is meant to produce less of those hormones, but it should be fine. So my whole suggestion is to fix the ovary, support the ovary. The ovary is controlling the estrogen and the progesterone and the testosterone. So why would you take a hormone? Because you're gonna inactivate your own hormones that are producing that. Okay. Now, someone says I had hysterectomy, so I take estradiol for hot flashes and night sweats. It took them away, but I recently started having night sweats again. So I started taking your cortisol. Could that be taking too much and causing night sweats? Well, what happens is the cortisol support is great typically for hot flashes, especially if you actually have a real true deficiency of adrenal and ovary hormones, because it basically helps you build more hormones. It's not for people that have high cortisol, it's for people that have low cortisol or low. The correct action for the remedy for hot flashes would be my ovary support formula, because that just supports the gland. But then if it's really severe, then we add the cortisol support. So so the goal is to support the ovary as much as possible. And after you've done everything you can, and if you still have problems, go ahead and take the bioidentical. But I won't just recommend going right to that right away, because there's side effects. Cancer, especially if a woman has taken estrogen over 7 years. That's like the cutoff point. And I'm also talking about birth control pills, and I know that's a situation for a lot of women. And I do have some solutions, but the problem is that birth control pills, hormone replacement therapy, it just gives you a lot of estrogen. So estrogen therapy also creates tumors. It decreases testosterone. Now, Depo-Provera. This is a type of synthetic progesterone. It's injected every like 3 or 6 months. Actually, I think it's every 3 months. And it gives massive, massive amounts of hormonal interference in your body. In fact, in 1973, the FDA denied the approval of Depo-Provera, but of course they didn't put it on the market. It has some serious side effects like breast cancer, weight gain, breast tenderness. I do not recommend Depo. Now, it's more convenient for women because you just get one shot and you're good for 3 months. I understand that. But think about if you have to take something to turn off your period for 3 months, do you think that might be creating a problem for your body? Yeah, it is. All right, so another question is, what if I don't have hormones? What if I don't have ovaries? Okay, then what you need to do is get a spare, go find them, clean them up, and put them back. No, just kidding. What you need to do is you need to support them with different things, because you have a backup organ. I like to support the adrenal if you don't have ovaries, because the adrenals make the same hormones as the ovaries. And so what you can do is you can take the support the adrenal, and you should be fine, because the adrenals should take over and start backing up the ovaries, okay? That's what I recommend. Everyone's asking about breast tenderness and breast cancer. I'm getting to that point. And someone also mentioned my mother took DES when she was pregnant with me. DES is called diethylstilbestrol, if I can even talk. And that is a massive, massive spike of estrogen. So DES was used to prevent miscarriages for like 30 years until they found that it causes miscarriages. So it creates a lot of problems for women in the offspring, hormonally, for the thyroid. It creates a lot of problems. So as we get to this seminar, I'm going to show you, if you've been exposed to DES, a couple things to detoxify yourself, okay? All right, so now the next thing I'm going to talk about is the estrogen thyroid connection. Let me show you something. Okay, so let me just bring this forward right here. You can see this, okay? Okay, this is the thyroid. These are ovaries. The estrogen is interesting because it has the ability to decrease the thyroid hormones, okay? Oh, wow. The way. Okay. So estrogen can block the thyroid. It can fit into the receptors of the thyroid gland. So when you increase the thyroid, the ovary hormones like estrogen, it will lower the thyroid hormones. And that is why during pregnancy, so many women develop because of the high estrogen. Most thyroid problems are secondary to high estrogen. During a pregnancy, estrogen dominance, taking birth control pills, other sources of estrogen. Okay? Another cause of thyroid problems, here's your liver. The liver activates the thyroid hormones, T4 to T3. Most thyroid problems are not primary, they're secondary to either estrogen dominance or a problem with your liver or gallbladder. Okay? There is a third condition, which is the autoimmune condition, Hashimoto's or Graves', which almost always occurs during a stress event. So because stress activates the adrenals, that would then cause an autoimmune. Hashimoto's is an adrenal problem, okay? So I just want to get into that, and I'll show you what to do about it in a little bit, but let me just kind of continue on with my slides. Okay. Now, the thyroid hormones are made from iodine. So the T4 and the T3 represent the number of iodine atoms in that thyroid hormone. Okay, so the conversion process from T4 to T3 also needs another mineral called selenium. So you need both of these minerals to have the thyroid work very, very well. So iodine you can get from sea kelp, seafood, cranberries, navy beans, potatoes, but we don't recommend that. Strawberries, we're not recommending fruit or berries right now. Selenium, Brazil nuts, you can get oysters, tuna, sardines, eggs, spinach, and sea kelp, okay? So we need those two minerals, and you can really help the thyroid function if you actually have those minerals in the diet. The problem is, because the soils are so low with, these are trace minerals, you never really see them in the diet anymore. You have to take them in an extra form, like, I don't know if you eat seaweed or sea kelp, or you have to consume more of an outside source or a supplement to get those. Hypothyroidism, a low thyroid, then can lead to slow gonads, or actually a hypo ovary or a non-functioning ovary. So we need that thyroid to work. If that thyroid goes down, you have a cascade of hormonal problems that go really, really wide to a lot of problems. Okay? So we have to be able to figure out, is it the chicken or the egg? In my experience, the most common thing is, and you have to ask the person, when did it start, to get the clue of the primary problem. Was it a pregnancy? Was it a stress event? Was it a thyroidectomy where they took the thyroid out? See, if you know that, then you can find out if it's the chicken or the egg. Now, the breast tissue, and I'm hoping you can see these slides. Okay, so the breast. The breast size is controlled by estrogen. So women that have larger breasts have more estrogen. It's definitely a symptom of estrogen dominance, but not necessarily all the time. You can have small breasts and huge hips and be estrogen dominant. Okay? Now, a lot of women go to the doctor to get a breast exam to make sure they don't have any lumps or precancerous benign cyst or in the breast. Okay? So we're going to talk about that, but here's the thing. Fibrous cystic breasts, which are little cysts in the breast, or even benign cysts in the breast, they're all they come before cancer. A lot of times you have a lump that turns into something over time. So it goes sometimes from benign to malignant, okay? So what we want to do is we don't want to wait until you're 55, 6 years old until you get cancer. I'm going to show you how to actively, aggressively prevent cancer. Because by the time you get it, you're going to be so freaked out about it, you're going to be, in a fear state, which is not a good place to be. And then the doctor's going to scare you into removing your breast or taking out the lump or doing invasive surgery and chemo and radiation. And that's just, a lot of times it's unnecessary because it can be prevented. Okay? So before I go on to the next thing, I wanted to see if there's any questions that you guys have. Let me see. Itching underneath the breast, symptoms of breast cancer? No, that is not a symptom of breast cancer. Postmenopausal bleeding, let's see, about to turn 60. Let's see, you may have low amounts of vitamin A that could be causing the bleeding. Article states certain amounts of vitamin A build up. And listen, Kathy, if you have a lot of vitamin A, you cannot, it's almost impossible to become vitamin A toxic unless you're taking a supplement of vitamin A that's synthetic. Become too toxic from vitamin A from food unless you're eating bear liver or something like that, okay? Where they have super concentrations of vitamin A. So it's highly unlikely that it's vitamin A. I'll get into some remedies and solutions for that. So the slides are still sticking? All right, sorry about that. I will, I'm also going to send you guys the slides, and I will also not do too many slides at one time. Okay, I'm going to show you how to prevent breast cancer. Okay. Prozac for mood swings. I'm going to show you what to do for that as well. You guys are in the right place tonight because I'm going to show you some stuff that really works, that's very effective. My thyroid started to fall after, yeah, my thyroid started to fall after the birth of my daughter. And it means that you had a spike of estrogen, and the estrogen blocked the thyroid. And so when you take, you may find that all your symptoms don't go away because the problem is not your thyroid, it's the estrogen dominance that you need to clean up. Okay? Good questions. All right, so let me show you the next slide here. Menopause. Here's what happens. You know, of course, when you go through menopause, you're going to have a drop in estrogen, big time. But you have way more deficiencies of progesterone than you do estrogen. So the relative ratios of estrogen progesterone will show you that you have too much estrogen. So you may not be estrogen dominant, but you have way too much for the levels of progesterone. And so you have what's called unopposed estrogen, which means it's out of balance. It's very similar to sodium and chloride, salt and potassium. So let's say, for example, in the body, you're consuming too much salt without potassium. You get fluid retention. So then you can avoid salt, but if you took more potassium, you can actually lower your relative ratios of sodium by taking the opposite mineral. So the point is that during menopause, the natural thing to happen is the adrenals take over, and yes, you're producing less estrogen, but you may need some help to support the backup organ, the hormones, during menopause, which is the adrenal. Okay? So a lot of women actually get results with progesterone creams, and I'm not opposing that. And a lot of that's natural. But let's kind of look at the whole picture first before we decide we're going to start taking hormone creams. Hot flashes. You can see the adrenal glands are the backup to the ovaries. If that ovary stops working, then the adrenals also can't back them up because they're tired. You're going to get hot flashes. So with menopause, we want to always support the ovary and the adrenal at the same time. Okay? I'll get into what to do in a minute. Now, I want to make sure my slides are advancing. Okay? I'm going to do one at a time. I want to talk about something called polycystic ovarian syndrome. You might not have this, but some people might have it, and I might just need to cover what that is. PCOS. Now, poly means many, cyst on the ovary, or disorders. Could be called PCOD disorder or PCOS. But in reality, it's not really a cyst. It's a follicle, which is very different than a cyst. They should call it polyfollicular ovarian syndrome, but they don't. It means that polycystic ovarian syndrome is going to produce more androgens. Androgens are the male hormones. So you get facial hair, a deeper voice, you get acne, you get belly fat, all right? But the question is, why don't men have this problem? You know what? I mean, they have high estrogen because, like you might say, well, it's the high level of androgens that's causing this problem, right? It's really, the question is, what causes this? And I'm going to tell you, it's not, there's another mechanism here, and that is this. It's insulin. Insulin can increase. Insulin has receptors in the ovary next to the androgen receptors. When you have high levels of insulin, it can trigger an excess of androgens. That's the cause and effect relationship. And that is why every single person with polycystic ovarian syndrome has insulin resistance. But what they're telling you is that polycystic ovarian syndrome is a disease that has an associated symptom of insulin resistance. That's incorrect. This is the cause of that. How do I know that? Because all you have to do is correct insulin resistance, and this goes away. Okay? Now, I've done webinars, last webinar on how to fix insulin resistance. I have videos on YouTube on my blog, how to fix insulin resistance. So I'm not going to get into it because I have a lot to cover, but I'm just letting you know if you have PCOS, you have to bring insulin down real low to be able to do this. So watch the other videos and actually correct that. Okay, so that's polycystic ovarian syndrome. Okay, good. Next association, we're going to talk about the prostate. Okay, the prostate is a pump, and the question is, what causes prostate enlargement? Okay, now on the webinar, we have a bunch of women and a few men. And I'm going to tell you, or you can actually even talk, you know, if you're married. I'm going to just light here. That's a little bit better. Okay. I'm going to close these shades. Worked, didn't it? Okay. So here's what happens. A lot of times, us men are told that we have to. This is ridiculous. I'm trying to get this light. I think it's this. It's reflecting off this thing here. A lot of time, men are told that what causes prostate enlargement is excessive testosterone, a very powerful testosterone called DHT. Okay, that's testosterone. But it's true. Why do men, when they get older, have prostate enlargement, but they show signs of low testosterone? Lower inability, erectile dysfunction, prostate enlargement, urination problems. They have all the symptoms of low testosterone. If high testosterone caused prostate enlargement, that doesn't make sense. So here's the truth. There are treatments out there that treat prostate enlargement with DHT, which is high-powered testosterone. So they're actually taking testosterone to fix their prostate. Because the truth is, it's high estrogen. So estrogen increases and make things bigger. Testosterone doesn't. The truth of the prostate enlargement is that these men have too much estrogen and they have too little testosterone. Okay? So that's why they lose some of the hair on their legs. The skin becomes smooth. Their voice starts to go higher. They have a lot of urination problems because it's high levels of estrogen. That's what causes it. So what they should do is lower the estrogen to be able to fix the prostate. Okay? So again, I want to just check if there's any questions. I'm sure there is. Someone says that, what can change the health of the sperm? I'm going to cover that. Excess estrogen, I'm going to talk about that. You guys are already there with me. If you had your thyroid removed, you're going to have to take thyroid hormones. Okay, so because you're going to need to take it, but I'm going to recommend taking a natural thyroid hormone, so like Armour thyroid if you can find it. All right. I'm going to also talk about if you have PMS. I'm going to talk about what to do for high and low estrogen, so no worries on that. Let's see. Can you have PCOS without ovaries? No, you cannot. But you might have symptoms of facial hair, and that could come from the adrenals. Ovarian only occurs if you have ovaries. Can you reverse facial hair? Yeah, absolutely, but you have to fix the insulin resistance. Watch the videos from last week. Please show me stretches for exercises. Waiting for your video exercises. Yeah, we're not going to be doing exercises in this. If your voice is lowered as a result of PCOS, is reversible? Absolutely. These hormones can bounce back. Okay, you can do a lot for your hormones, and so don't ever buy in that you can't reverse a lot of these issues. Okay. All right. So now I'm going to go into the next section here. Okay, testosterone. What does it do? Produces facial hair. It produces sperm, prostate growth. Only when you're growing you're growing initially, but as soon as you hit like 20 years old, stop growing. Okay. Strength, muscles, sex drive, bone, muscle. That's what testosterone does. All right, this is what I want to talk about right now. A lot of you are probably wondering, like, why do I have estrogen dominance? Why is there so much estrogen out there? Why are people getting breast cancer? It's because there's this environmental estrogen. I don't know if you knew this, but there's a term called endocrine disruptors, or you can call them environmental estrogens, because endocrine disruptors basically are all the different things in the environment that mimic estrogen. Okay. So it'd be like pesticides, insecticides, herbicides, fungicides, heavy metals, mimic estrogen. So they act like your own hormones. All right. They're in the weed killers in your food. They're in your lawn. They're in they're all over the place. Gardening. They're at they're like new furniture has endocrine disruptors. They're in the food supply. They're in the vegetables or the plants or the corn and the soy that feed the animals. So they're all over the place. So it's hard to become to these things. Now, you remember DDT that was banned in 1971? DDT is still being found in over 50% of children, okay, nowadays, but it was banned in 1971. So what I want to ask you right now, how can this be possible? How can anyone be exposed to DDT because it's been banned? Can anyone tell me where this DDT is coming from? And I'll wait for your answer as I answer another question. Oh yeah, Cindy, you just want to know what with the natural thyroid, it's called Armor. They have other ones too, like natural thyroid hormones. Okay, but Armor is one that I know is like a natural. It gives you all the hormones. Okay, okay. Someone's saying the soil, the soil, the soil. All right. So Vivian, you're correct. Third world countries like Mexico, South America. See, in the winter, we get our fruits and our vegetables from third world countries, which we sell our DDT to Mexico and South America. We buy the vegetables back in the winter. That's where you're getting it from, DDT. DDT was banned for a reason. So we got DDT. Still out there. It's also in the soil, probably not as much as it was. 30 years after DDT was banned, America still consumed trace amounts of the insecticide, along with 20 other banned chemicals. Welcome to planet Earth. Now, the next thing we're going to talk about is the GMO, okay, genetically modified. We'll have to give you a t-shirt, GMO, OMG, WTF are we eating? Okay, what are GMO? The result of genetically altered foods. So they take the DNA from one species and they artificially force it into the genes of another unrelated plant or animal. The foreign genes may come from bacteria, viruses, insects, animals, or even humans. Okay, that's what GMOs are. Okay, don't worry, it gets worse. Glyphosate. Okay, now I have to make sure that you're seeing this slide. Can you guys see that okay? Glyphosate is pretty deadly. It is Roundup Ready. That is the main herbicide, weed killer, basically in all the GMO, because the reason why they make the GMO is to resist that glyphosate herbicide. So they can spray on the corn, the soy, the wheat, the beet sugar, cotton, the mangoes, the papaya, so they can spray it, so they can basically have this plant resist that and spray more. So these foods always have residue of glyphosate, okay? So I just want to let you know, that is the main chemical that you're being exposed to right now, against your will. Don't worry, it gets a little bit worse. It's the most widely used herbicide, over 600,000 tons in 2008. All right, it's in United States, 33%, Brazil, Argentina, China, India. Glyphosate is found in the urine of 93% of Americans tested. Wow, where are they getting this from? Well, you don't have to label GMO foods anymore, you never did it in the US. I think in Europe you can label them, but that's where you're getting it. But don't worry, Monsanto said that it's safe. They said it's classified as a practically non-toxic chemical. So you have nothing to worry about, right? They say on their website that over 40 years of use, 800 studies, over 160 countries, and it's completely safe. However, there's been some studies done by some really critical people, credible scientists, that found they did the studies a little longer than 3 months, okay, and they were independent studies, and they found that they developed tumors and died earlier, okay? So, but what's interesting, it's very hard to find this research because it's been retracted. They basically forced them to reject the data, which is just incredible that they did that. They're so powerful. Okay, glyphosate is banned in France, Netherlands, Brazil, Colombia, Bermuda. It's mainly in America. We just, we use it. An MIT researcher stated that glyphosate herbicide will cause half of all children to have autism by 2025. And that's another link that is fascinating because a lot of research is on vaccinations, but you never would think that would be on these GMO foods as well. Now, I don't know if you can see this slide, but there's a little bit of a conflict of interest between Monsanto, who makes glyphosate or Roundup Ready, and the federal government. So there's a lot of the people who worked for Monsanto, even the vice president, now, okay, even the works for the actually elected to the Supreme Court, used to work for Monsanto. So you're wondering why there's so much corruption, but you don't have to look very far. Now here's really what kind of blew me away, and there's called the Monsanto Protection Act, where it was signed that if at any time there was a lawsuit and they found that GMO foods were dangerous or whatever, this would protect Monsanto. They can continue to sell it and they will not get in trouble. Okay, so it is this Monsanto, their sister companies, Syngenta, Dow Chemical Company, Berg, DuPont. So they basically passed a law to protect themselves, which is incredible. Incredible. So I don't want to depress you anymore. So let me just make sure there's any, I want to see if there's any questions. Oh, you couldn't see the slides? I'm going to send you all the slides. GMOs are banned in Europe. That's awesome. I love it. Oh, that's funny. Monsanto's cafeteria in England advertises that they're not serving GMO foods in the cafeteria. That is hilarious. Wow, interesting. Okay, so let me get to the next slide. Yeah. All right, so let's go right into the solution. Now that you're done being depressed, okay? Is this one little amazing mineral called iodine. Iodine decreases estrogen dominance. Awesome, awesome, awesome. Iodine decreases insulin and helps insulin resistance. Iodine increases testosterone. Iodine decreases the risk for cancer. Iodine supports the thyroid, the ovary, the breast, and the uterus. Okay? So that's really, really cool. The problem is that in the 70s, we had 50% more iodine in our foods than we do now. The other thing that's interesting is that if you've heard of women with cyst and fibrocystic breast, especially fibrocystic breast or cysts on the ovaries, so fast with iodine. It's a fibrocystic breast is a precancerous thing, and you give a little iodine. I like to give sea kelp, and that goes away. Okay, so iodine is a known anti-cancer, simple remedy. All right. So now, is iodine salt? Absolutely not, unless you have sea salt, and only then it's going to be a very small amount. Now, iodized salt does have iodine more. Okay, and that's there's two types of iodine. There's elemental from rocks and minerals, and then you have plant-based iodine, which I like because your body can absorb it better. That's why we use sea kelp. Sea kelp is one of the best sources of iodine. Okay, interesting, interesting, interesting. Okay, I know there's some questions. Hang in there. Look at all the problems with iodine deficiency. Dry skin, cysts, any cysts that you have anywhere in the body, fatigue, thyroid problems, ovarian problems. See, what I wanted to mention was you hear about iodine for the thyroid. Iodine is for the ovary, just as much as the thyroid. Your ovaries, female reproductive organs, need iodine, trace minerals, to get rid of a lot of problems, including hot flashes, okay? And in a lot of women, not 100% of the time, but in a lot of women. Cognitive problems, menstrual irregularities, weight gain, breast pain, enlarged breasts during a menstrual cycle, cold feet, infection, psoriasis, type 2 diabetes, thinning of the hair, depression, puffy face, miscarriages, goes on and on and on, okay? So I will send you the slides. Okay, so here's the next slide. Hopefully you can see it. So we know that low thyroid causes low testosterone, and low iodine can cause low testosterone, and high estrogen causes low testosterone. So guess what you're going to actually recommend for a male to improve their testosterone? Iodine, sea kelp. That's one of the best remedies, okay? Now, does anyone want to know how to get this crap out of your body? Because we're all exposed to a tremendous amount of chemicals that they've pumped in there. We want to talk about how to detox our bodies, specifically the endocrine system, okay? The endocrine system, your endocrine system, especially because it's made from fat, is just probably filled with endocrine disruptors. And the endocrine disruptors affect you later in life as it breaks down and it gets into the system. Lady come in, and we worked with her, and we did very, very, very well with her thyroid. And I was working with her doctor. And she basically, was great, and she left, and then she came back like 2 months later, and I said, what happened to you? She goes, Well, I was doing fine, and then I went on a detox, and I end up with a thyroid problem again because all this crap out of her liver too fast. It went into the bloodstream and locked up her thyroid. Okay, so you want to detoxify correctly. I'm going to show you the best type of things to do this. But I want to just mention this is a really good book on the side effects of estrogen therapy, and I wanted to show you the top things that are kind of ignored. Like the doctors say, "Oh, you just take HRT, not a problem." But the big thing is it causes cancer, and the big thing is it causes strokes. So not only do you have estrogen in your bodies that it's locked up in there, but it's coming from the environment, coming from chemicals. Okay, there's the World Health Organization actually did a whole bunch of research on endocrine disruptors. Okay, so I looked at through all the research, found because I said, why don't they clean this crap up? It's because of the EPA has an endocrine disruptor subcommittee membership. The people, the organization that it controls the endocrine disruptors are a group of scientists that work from like Monsanto, Dow Chemical, Frito-Lay, Syngenta, pesticide companies. They're all involved in what they're allowing to be safe or not. So it's a huge conflict of interest in the EPA. Unfortunately, and this is why you really haven't heard much about this. This is why they're not cleaning it up. Okay. Look at this. I have a book. See this right here? This is the book on toxicology, the study of poisons. Look at how thick it is. This is all the body conditions that are coming from pesticides, insecticides, herbicides, fungicides. It has every single disease. But there's a huge disconnect between medicine and toxicology. They're not connecting the link between cause and effect. I believe, especially the cancers and a lot of the other diseases are coming from a lot of chemicals in the environment. It's the most obvious. Now, let me just make sure that I keep up with your questions. Yeah, I'm going to get to the detox next. Let's see. Okay, so okay, Terry, will there be notes again? Unfortunately, I missed the beginning. Yeah, I'm going to record this. I'll send you the. I'm sending you this. I'll send you the notes. I'll send you the PowerPoint so you can go through the whole thing. Okay. Let's talk about detoxification. This is the way. I just need you to understand like how the body can get rid of these chemicals. Okay, we're going to do it by through the liver. There's something called phase 1, phase 2 detoxification. There's a series of enzymes in your liver that are triggered by certain foods that I'm going to highly recommend that you take care of and include this in your diet immediately, because this will slowly dismantle any poisons that are sitting there waiting to turn into cancer. Okay, so in phase 1, these enzymes, which is amazing because they will convert poisons into phase 2. And phase 2 basically turns these fat-soluble chemicals into water-soluble chemicals. And so that way they can come out through the urine very, very safely. So your body already has the ability to get rid of these poisons. Isn't that cool? Would anyone like to know what food that this would be? In fact, let me just ask you, what foods you think are good to detoxify the liver and the rest of the body from through the phase 1, phase 2 detoxification? And as you're answering that, I notice that there's a question: are coffee enemas safe to use? I think they're fine. I think that's good way to purge the liver. It doesn't pull the chemicals out, but I think it's a great thing to do. Okay, kale, watermelon, leafy greens, salads, apples, beets, broccoli. Okay, good. You guys are sharp. You're exactly right. It's the cruciferous vegetables. So let me just touch on that a little bit. Cruciferous vegetables are basically those vegetables have a cross-like symbol on the leaf. So they're little crosses on the leaves. Okay, that's why they call them cruciferous. Now, they have unique properties, and they're called phytonutrients, or plant chemicals that have additional health benefits. So, for example, the radishes, the red radish, is very high in a certain natural chemical called sulforaphane. It's high in sulfur. It will basically detoxify poisons that trigger cancer, and it will even kill cancer on contact. There's been studies on that. So there's tremendous amount of studies. We're just not doing anything with the studies. Okay? But you can use these foods to decrease your risk for cancer. Even if you consume 3 servings per week, you can decrease cancer by 40% in certain types of cancer. That's incredible. That is unbelievable. I mean, you should be doing it more than 3 times a week, but we have like the kale, the broccoli, the Brussels sprouts, and the bok choy. Now, I put some other vegetables on here as well because those are real good anti-cancers too, like beet leaves, garlic, turmeric. Those are really, really important. The chemistry of Brussels sprouts, unbelievable anti-cancer. Unbelievable. So, how many of you consume cruciferous vegetables in your diet? Okay, on a regular basis, in enough amounts? Go ahead and tell me, and I'm going to answer a couple questions. And a very good question. She said, now what about, wait a second, you just start talking about the thyroid, and now we're actually cruciferous. If we take all these cruciferous vegetables, we are going to, and our thyroids aren't going to work, right? Well, we're going to actually add more iodine and take the cruciferous, because the benefit of the cruciferous for the thyroid to pull that estrogen out is all we have to do is add some sea kelp. So the combination of adding sea kelp is a perfect match. We're not just going to take, we're just not going to take straight, cruciferous without any extra iodine, because we may deplete our iodine reserves a little bit, but you'd have to consume a lot. Okay, so Carolyn says several times a week. Hate them. I do 5 to 6 cups daily. Cool. Okay, good. So you guys are, when I consume sea kelp, my throat feels swollen. That could be because either the sea kelp is toxic, which a lot of times, if you take sea kelp from a polluted ocean, a lot of extra heavy metals and chemicals that are very, very reactive on your thyroid. I use a type of sea kelp that's from Iceland. It's certified organic. I've never had a reaction. It works really, really good. Slides here. I'm going to give you some solutions, and I'm going to talk about the ovary kit. I'm sorry, it's the estrogen kit. Like some of you are asking about the ovary, and at these webinars, I always give you guys a little discount. But here's the thing. A lot of times it's hard to find or consume the amount of cruciferous in the diet in the range of different types of cruciferous foods. So I use the whole cruciferous food combined with the organic sea kelp together, and I recommend that you would do between 3 and 6 cruciferous and 2 organic sea kelp in the morning. Now, why do you do this in the morning? Specifically the sea kelp, because if you take sea kelp before bed, it will wake you up. It'll make you very, very awake in your brain because it activates mental alertness. So it's really good to take in the morning. You don't actually need massive amounts of sea kelp. Morning is totally fine, okay? Now, if you don't have a thyroid, maybe you take an extra. If you have fibrocystic breasts, you can take extra, okay? Now, the ovary support that I have supports a low thyroid and a high thyroid. And a lot of you that I'm recognizing you from my membership site are already taking the ovary support. Basically, in the ovary support, there's a combination of herbal ingredients that support estrogen to balance it out, and glandular extracts for the ovary, for the pituitary, and for the adrenal. So it's the best thing for a menopausal supplement and also from PMS. So if you were to ask me, what do I do for PMS or ovary problem, I give the ovary support. Okay, so if anyone wants to have this kit, I'll just post it right now. Let me just give it to you. Okay, so this kit is basically designed to clean up the endocrine disruptors and give you enough iodine, and also support the ovary. If you don't have an ovary, then or ovaries, then you definitely want to take this too, because it kind of supplies the raw material for the body that whatever you're missing, basically. Okay. Now, what if you're a male body? I do have a solution for that, but I'm going to first answer some questions. Someone's saying, what about DIM for estrogen dominance? Now, DIM is extract of a cruciferous vegetable, and I found that DIM is actually very effective. But my thought is, why not take the actual vegetable itself? Because DIM is one extract. Just one cruciferous food would have over 600 different types of phytonutrients. So it's very, very, very more complex than just one individual phytonutrient. It's called DIM. And so I like DIM, but I would recommend all of the cruciferous together if you had a choice. Does the wheatgrass have sea kelp in it? No, it doesn't. But the whole cruciferous food does have some sea kelp in it. Okay. Now, if you guys get this kit within today or tomorrow, I'm also going to send you my acupressure technique for the ovary. Now, what is that? What can you do to the ovary? And this technique is already in my membership site, so if you're in the membership site, you probably already have seen it. However, I'm going to just give it with anyone who gets this kit. And if you're a male body, you're not going to need this, but it's mainly to help support an ovary that has been damaged, or a menstrual cycle that is altered, or a problem with the ovaries or the uterus. Okay, any problems, whether it's a fibroid, a heavy period, hot flashes, you can use this technique. And the reason why I developed a technique is because it's very difficult to find any type of acupressure techniques for the ovary. So I developed it over a long period of time, and it's very, very effective. It's a great way to do a demonstration at a seminar because it works very fast. You can see changes, especially if someone's like depressed that time of the month, or they're having a heavy period. You can see changes immediately if you do the technique, because an average female has over 400 menstrual cycles in their lifetime. That's 400 traumas to the uterus and the ovaries, not to mention if they had pregnancies, miscarriages, abortions. All that trauma needs to be cleared up. The acupressure technique fixes the trauma from the female organs. Okay, that's what it fixes. Because when you have this trauma, you lose your communication lines to that area of the body, and it starts to become out of balance. Okay, And yes, it would help you with an ovarian cyst. I took a lady who had a cyst the size of a lemon on ultrasound, and we did the technique, and within 3 days, it went away. All of her pelvis that was kind of rotated came back, and she felt all of her back pain went away. A lot of times the pain from an ovary will cause sacroiliac pain in the back of, like, either the right or left side of your lower back. Okay. I was asking a question about fibroids. Fibroids are primarily an excess estrogen problem. The same thing as ovarian cysts. It's just too much estrogen. So you need to, number one, make sure you do the diet that lowers insulin for sure. Okay, because insulin can also make things get bigger. Make sure you're doing a lot of cruciferous vegetables, because that is the thing that's going to shrink it. Okay, and also iodine. Iodine will shrink it too. But I'm just giving you a solution for the food base. How much iodine should be considered if one has a fibroid of the uterus? I don't like to recommend individual milligrams of iodine. I recommend more of a C count, because it's a food-based complex with all the minerals, with a heavy amount of iodine. It's in a plant base. So I would recommend, for a fibroid, I would recommend 6 sea kelp a day, but consume before lunch. Okay, if you have fibroids. You have indigestion with cruciferous vegetables, especially broccoli, like I do, which, by the way, is the reason why I took out broccoli out of the cruciferous, because it was creating problems for myself. And I haven't had many problems with people taking this blend, because I took out the broccoli. But if you are very sensitive, then you're going to have to consume, like, steam them, cook them, or have other vegetables like spinach or kale is pretty safe for people. Okay. Did you say these supplements have wheatgrass in it? No, these supplements do not have any wheatgrass. And by the way, wheatgrass does not have gluten. There's no gluten in wheatgrass. How much iodine? Let's see. How many whole cruciferous do you recommend a day? I recommend between 3 and 6. If you don't have a problem and you want to do a preventative, do 3. Do 3 a day. I mean, that's one tablet is equivalent to 1 serving. So you're going to protect your body, your breast, your tissues over a period of time if you did it every day. It's a great protective thing. How can I overcome the effects of hysterectomy or gallbladder removal? Well, you're going to have to support the adrenals, and you're going to have to probably take a little bile from the gallbladder formula to help the liver detoxify a little bit better. Does your kale shakes count? They count a little bit, but it's you need to take it. It's probably, you're going to have to, if you added the kale shake with the kale and made a shake, I think that would be a really good thing to do. Okay, but the cruciferous must be organic. That's a good question. Should the cruciferous be organic? Now, all of the vegetables that I'm recommending in this product are organic, but sometimes it's hard to find organic. So if you can't find organic, it's much better to consume any cruciferous than no cruciferous. Okay. I really like green beans. Any benefits from these vegetables? Yeah. So if you have green beans from a garden, there's great benefits, especially in the bioflavonoids and vitamin C complex. What if you get a migraine on the 3rd day of your period, that almost every single time? That's estrogen dominance. Okay. What percentage of the kale shake is kale? The kale shake, my instant kale shake, is based on serving size, and there's like 1 cup of kale per serving size, per scoop of that kale. Okay. What is bile, and what does it do? And yes, I do have bile in a product called Gallbladder Formula, which, by the way, is out for another 2 weeks, unfortunately, because it's a very popular thing. But we'll get it in 2 weeks. But you just take 1 after you eat. It helps you convert the thyroid hormone. It helps you digest. It helps you for bloating. It helps you absorb vitamin A for the eyes. Fermented cruciferous food, okay, I think it's awesome. Yes, it's totally fine. I understand cranberries are high in iodine, but they're high in fructose. Yes, they are high in sugar. That's why I don't recommend getting your iodine from that, any more than I'd recommend getting potassium from bananas. Someone said pancreatin. That's an enzyme for the pancreas. That's actually in the gallbladder formula. Bile is different than pancreatin. Bile is from the gallbladder. Pancreatin is the enzyme from the pancreas. Okay. How long will it take to see progress with C-kelp and fibroids? I think if you did everything correct and you really followed my eating plan for the insulin resistance, you would start seeing change within a couple weeks. Okay. Probably more change after a month, because these natural the C-kelp and the cruciferous, they work slowly, and you don't want to pull these chemicals out too fast because it's too toxic. Let's see. I wish I would have known this before having hysterectomy. I know. They really push those things. I have gas from eating broccoli. I know. It just tears me up, so avoid broccoli. Are steamed Brussels sprouts good? Absolutely. Yes, it's very, very good. Now, someone asked, what about men for testosterone? Okay. There's another kit that for them, and that's slightly different. I'm adding something called DHA. DHA is a healthy fat that basically supports the testicle. So it gives the testicle the raw material. Okay. So there's a little kit there for men that have low testosterone, because what we're going to do is we're going to lower estrogen, thereby increasing testosterone. The DHA is really good also for increasing testosterone. It feeds the testicle food for it to manufacture more hormone. Okay. So that's the testosterone kit. Okay. Can you just stop HRT? I can't tell you to stop anything, but just between you and me and the four walls, even though we're doing a live webinar here, I do not think there's any problem with stopping it too fast, as long as you can support the underlying root cause. Again, I didn't tell you to come off of it. I'm just saying that I don't think there is a problem. What about oxalates? If you have oxalates, high oxalates, you need to be consuming a lemon juice. Okay, lemon juice or lemon in your water every single day. Okay, that will handle that. Sylvia says, will the discount be automatically deductible when ordering the estrogen kit? Yes, it automatically is deducted. You click the link, and then it will automatically take it off. It'll be on the right column. You'll see it. But it's 10% off if you wanted to get it within the next 24 hours. Okay, so what if I try the adrenal package first? Not a problem, Lorraine. You can do that. Totally fine. In the adrenal kit, let me think. Okay, never mind. Let's see here. Where can I find a diet for estrogen dominance? What if I take estrogen kit with cruciferous vegetables, should I follow the keto diet plan? Yes, you should follow the keto diet plan, because you want to keep insulin low. And I have a lot of videos on what to eat, what diet you should be on. Let me just see here. Let me just see if I can read that. Do I also take an insulin kit? No, you don't take an insulin kit. You just need to follow the eating plan that I recommend to lower insulin. My sister has epilepsy, and the only time she has seizures, let's see, with medication levels are low. Seizures are related to insulin. So if you go on a low insulin diet, it's called a ketogenic, that is wonderful for the brain, and that also epilepsy. Yeah. So check it out. Ketogenic diet. Should we get potassium from? You know, it's interesting you said that, because one of the best sources is sea kelp. You have a lot of potassium in sea kelp, but also from leafy greens. You need between 7 and 10 cups. All right. Let me see here. Do you have the cruciferous food in stock? Yes. Yes. And I know if you're back ordered, we've been sending it out ASAP. We just got it in. We have tons of it. Yes, it's being shipped out. You should get it any day now, Sheila. Okay, so we answered that question. Is drinking 6 to 7 or 5 to 6 kale shakes too much? Not if you're doing the sea kelp, and not if you're to counter any possible oxalate stones. Okay. What if someone's very high progesterone and the very low estrogen? Then I would increase your estrogen by maybe a non-GMO tempeh. It's a fermented soy. That might give you a little more estrogen. Support the ovary with the ovary complex, or the ovary support, because that actually gets your own body to produce more. Am I getting enough DHEA taking cod liver oil? Sometimes you are, but make sure, Elaine, that the cod liver oil you're taking is virgin cod liver oil. Don't get the regular cod liver oil. Is your cruciferous product raw? It's basically under heating like 106 degrees, but it's not completely classified as raw. But the enzymes are active, pretty active, but I can't make a claim that it's raw. But it's organic. How can I relieve restless legs that drive me crazy? That's a B vitamin deficiency and adrenal deficiency. So the best thing for restless legs is the adrenal day. Handle it within a day. I take wheatgrass daily. Does it contain potassium? It contains a lot of potassium, a ton. Do you have anything for toe pain and toe cramp that gets worse while walking or taking D3? Yes, you need to take K2 to transport the calcium. Also, you need more potassium. And then the third thing is you do acupressure on the opposite toe. So for example, right big toe, you massage the left big toe, okay? That should get rid of your pain. Does taking K2 increase estrogen since it's from NATO? Not at all. Minor amount of NATO. It's not filled with estrogen. It's not going to be a problem. I have one ovary take of the ovary support. The ovary support, it really depends. If you have symptoms like hot flashes, you take 3 before bed. If it's during the day, take 3 during the day. I would recommend taking 3 for a while, and then some maintenance. But you'll see that ovary support creates some really cool effects for females because of the amount of issues they have with the ovary. Find something that supports an ovary that produces too much estrogen and not enough. It actually balances it out. Is there anything that isn't in pill form? I only have the wheatgrass, but you could just open up the capsules and pour it into something. Someone said they did the acupressure on the gallbladder, it was inflamed. If you have an inflamed gallbladder, Karen, you don't want to work on the gallbladder directly, you want to work on the opposite side. And that will help because you want to treat it like an injury, work on the opposite side. What are oxalates? Are chemicals that form calcium stones. So they bind to calcium and they form stones, and that can come from the cruciferous. Have like enough lemon in the diet. So lemon is a really good thing to add in your water. Is it possible to get rid of thyroid nodules? You know, Merck Manual, major medical books that you study in pre-med, back in 1850, they used iodine to cure thyroid nodules and all tumors back then. But mysteriously, they don't recommend it anymore because, of course, there's no profit in it. Thyroid nodules is the iodine deficiency. I know. They just do biopsies and they don't give you the iodine. It's crazy. Take this with the adrenal day and night formula? Sure. Robert, improving testosterone. I recommend doing the kind of a cruciferous and so the sea kelp for that. I have polyps and fibroids. Any natural forms of birth control besides condoms that won't worsen my fibroids? There's something called the Lady Q stick. Now, you're going to laugh because the Lady Q stick is $25 on Amazon, and you can put saliva on it, look up into the light, and determine if you're fertile or not. Fertile, it'll have a different, like a fern kind of a pattern, and if you're not fertile, let's see, if you're not fertile, it'll have little specks. So it'll tell you when you're the most fertile and when you're not. So you could kind of use that to know if you. The problem is there's always that small chance that you might be fertile when, you know. So, but they offer a money-back guarantee. You can get your $25 back. Okay, it's true, but I have a dry sense of humor. The other thing with birth control pills, and this is a really, because what do you do? What do you do if you don't want to use condoms? You have to use birth control. I mean, I don't really have a solution for that. I don't, unfortunately, because you know, there's pros and cons. Like, because the birth control pills have so many side effects down the road, it's an issue. Okay. I'm a mixed body type, thyroid, adrenal. What kit is best? Start with the adrenal because the thyroid is usually secondary. Okay. I have too much calcium in my blood. That means you need to stop taking vitamin D and take K2 only. Calcium from the blood. Okay, so someone says, Karen says she has the tool. Yeah, start using the massage tool. That will help you sleep. Let's see, Dr. Berg, let's see here. Okay, so if any of you have any questions, like the last seminar, you want the notes, or you want the webinar replay, you can just call my office and get it. Is Parkinson's related to estrogen dominance? No, it's related to insulin dominance. Have you dropped the super nutrients? Yes, I did, because a lot of the ingredients are in the wheatgrass. So my wheatgrass is my new super nutrients. How much K is in the wheatgrass juice? There's actually a lot of vitamin K, and that's the problem with people that are on Coumadin. Let's see here. If you're taking a blood thinner and have low potassium, I would start taking vitamin K2, and a lot of them, because they'll have potassium in it. Do you assume that if you're eating a lot of cruciferous that you have high oxalates? Chances are, yes, you have high oxalates. So just in case, start chomping down on the lemons. Does NATO from K2 increase estrogen? Hardly at all. It's not going to be a problem. I have one ovary. How many sea kelp and ovary support should I take? I would take 2 sea kelp in the morning, 3 ovary support. Kidney stones, then you need lemon juice. My doctor prescribed Luger's iodine for cystic breast. Well, that will work. I like to take it in a complex because they're plant-based minerals, and I see them work very, very well. So I have no desire to take a individual elemental liquid iodine. Are your products safe to take when taking Synthroid? Absolutely, because they're just food-based. That's why I like them. They're not synthetic anything. Do you have anything for foot pain? I have videos on foot pain. You should do a search with Dr. Berg. Anything for Parkinson's? Yeah, lower the estrogen in the diet. I only have one adrenal. Support the other adrenal. Can I take ovary support while on the Lupron? Absolutely. If in menopause, does supporting the ovary belly fat? No, it helps you lose fat around the hips, in the lower pooch in the stomach. Wheatgrass harvest at what point in time? How long was the wheatgrass growing? Yeah, it's seasonal, and that's why I have to order it a year in advance, because it's seasonal. And I can, if you want to email me, I can give you specifics on that. Need to lose 35 pounds. Should I start with the adrenal kit? Rob, I would start with the adrenal kit if you primarily want to lose weight. Testosterone kit. Testosterone is mainly specifically for testosterone, not necessarily weight loss. I had an ablation of the uterus. Is it okay to take over? Oh yeah, then that's a trauma. So you need to do the ovary formula and also the ovary technique. We'll send it to you via email. Which diet should I follow from the insulin diet or the adrenal diet? You need to do the adrenal diet, because that's included. In that diet, I'll show you how to lower insulin. As you see, I'm going real fast through these. I'm trying to answer more questions this time. Sounds going in and out. Well, I will send you the replay on this. Meds for 3 years. Is there a chance my thyroid can recover? Yeah, absolutely. I've had people on Synthroid for 20 years come off that stuff. So the thyroid can bounce back nicely. Anything for Hashimoto's? I would do the protocol for the estrogen protocol for Hashimoto's. That's what I would recommend. How many days to heal PCOS with a keto diet? I think it's going to happen pretty fast. You'll start seeing changes probably within a week or two. Okay. So someone had a question about orders. If you have any questions, you can just call my office tomorrow. I've been taking the adrenal night formula. I dream more, but I still wake restful. Oh, you're asking, but I still wake restful? How does the adrenal night work? It basically relaxes the adrenal so you can get into a deeper delta wave sleep. Seek help even when taking Synthroid? Yes, you can. Increase the need for Synthroid over time, but it won't be a spike because it's in a food base. All right. Okay. I hit my hour-and-a-half limit here. So I want to thank you guys again for listening this long. I appreciate your attention. Great questions. Thanks for your interest. Some additional, the PowerPoints for anyone who's on here. And if you have any questions, go ahead and email us. And stay tuned for next week. We're going to do this again. I'm going to talk about a different set of hormones, okay? So have a great week, and I will see you guys real soon.